Well, how do you follow that? Thank you, Ben. I'm Ming Tang. I'm the Chief Data Analytics Officer for NHS England and know quite a lot of you, actually. Really pleased to be here today. It's quite a pivotal day, as everyone has said, and I'm really glad that we're able to facilitate this and looking forward to next year, Peter. But Ben's quite right. This is a start of a journey. We won't get it all right, but we need you to participate in that journey. We need you all to be quite vocal and tell us what else you need, right? So, unfortunately, or fortunately, I'm the head of profession for data and analytics across the NHS. It's quite a funny role, really. You get given the hat, no resources, no plan, nothing. So together, I hope we can help support some of this. So we've got Sarah here, Blundell, and Sarah Colkin. Is she here too? Yeah, hi Sarah. They've been the two ladies that have been doing some of the real work on some of this stuff around analyst development, and I think Andrew is going to be talking about the competency model later as well. So do go and have a look at that, and we'll get going. So can I have, what's that? Oh. So 1 year on from Data Saves Lives, built on quite a lot of what Ben's review did. What we're really looking at is a journey where we make more certain the things that we do with data and analytics, and really make sure that we make use of the data, we bring the workforce, but also bring the business users with us. That's quite a difficult task in itself, but we also need to bring the public with us. So we are getting to the stage where the use of data is really powerful. We've got some really sensitive data that we would like to use in a safe way, and putting in the data platforms and secure data environments or trusted research environments. It's really important now that we start engaging with the public. So all the stuff that you guys do has to have a rationale, has to have some business value, but we also need to make it so that we reduce the effort, the amount of effort it takes to do a really simple piece of analysis at the moment, either because the data is not organised, it's not curated, it's not standardised, and actually doesn't flow to the right people in the right hands so that they can make decisions. So there's all those things that are really broken. We also want to use data for data research, and Sue's going to be talking in a minute about her vision for genomics data. We are moving to kind of operational uses as well as personalised, digitalised medicine. That's really exciting. It's also quite scary, and we need to really get our foundation stuff in place before we can move on and be sophisticated. I'm going to move on. So really, this is kind of pulling together why are we doing this. At the end of the day, all the data in the NHS and all the analysis that we do primarily are around giving better care for individuals. And if you think about that in a way, all the data that we're collecting around services needs to make sure that we actually provide better analysis to improve health and care. So personalised medicine, Sue's going to talk a bit more about that. We need to move to real-time analytics. That means the best data that we have, it's not always going to be perfect. We need to move away from published statistically perfect to actually order of magnitude, are we going in the right direction, and then really repeating those analyses over time so that we can refresh them. So real-time analytics will be really good. It'll also help our clinicians identify where we've got risks, where we've got complications. Some of you are working with integrated care systems. That's really important for them. We also need to take this data and become a bit more predictive. So I joined the NHS about 14 years ago, and I think I was working with Peter when we were part of the West Midlands team, really running some of the support services there. Through the last few changes, we've not moved on in some of the things that we could do. Some of the things we were looking at over 10 years ago, which was around how we use risk stratification, how we better predict analysis for patients. Because of all the changes in the NHS, we've kind of been stymied and gone backwards sometimes. So we need to build up that predictive analytics and really understanding why are we doing it. Not just from an analytics perspective, but from a whole end-to-end perspective. So we'll be asking you all to work much more into multidisciplinary teams, because this is, you know, to solve a solution, to solve a problem with a good, sustainable solution is a team game. And that requires analysts, you know, clinicians, as well as operations teams and finance people, right? So we need to bring all of that together. And the reason we're moving towards platforms is to bring that analysis together, have the predictive tools that can then help create better decisions. There's a lot of digital at home now, remote monitoring of patients. Through COVID, we've invested enormously in virtual wards, in wearables, making sure that patients can be looked after at home. It's much better for them to be at home than in hospital when really there is step down or rehabilitation. But how do we harness that data? All the digital efforts that we're putting in, are we really thinking about the data that we could use? And then how does that data help us to create alerts and better management of care? So again, quite a lot of that. The social determinants of health. We are now moving into a world where, you know, we've got children that are really obese at the age of 8 without thinking through the kind of 75 to 80% of the population. They're actually relatively healthy. How do we make sure we have the data to support those people to keep well rather than always focusing on the 20% that are in acute care? How do we use data analytics to make the case, both from a financial standpoint, but also from a health and well-being standpoint? And what data do we need to bring together in order to accelerate maintaining people at home and bringing them out of hospital? So all of these things, data analytics is going to be critical. I really like Peter's and Ben's separation. In our competency model, we do think about, you know, data collection, data curation, data engineers, and then really the analysts and the reporting side. So we have separated them out in the competency model. Adoption's hard. Cultivating a culture for data is really hard. It's actually really hard amongst analysts. I'm going to be really controversial here. Actually, amongst analysts, cultivating data culture is really hard. Why do I say that? I say that because people are really set in their ways. They're quite used to doing the reports that they did, the way that they looked after their little spreadsheet, or the way that they manipulated data, and all, you know, all the tricks that you've all learned over time. We want a cadre of people that can change that into the newer ways of working. Working on a platform is quite different to holding the data on your laptop and being able to manipulate it the way that you normally do. So that's a change. We should recognize that. And I was on a course recently where they said every change is actually, you need to recognize it. It's almost like you need to mourn it before you can embrace the difference. So we should have a celebration on getting rid of some of the old school things, because actually working on a platform is really beneficial for analysts. And in doing that, you can really advance and really focus on insights and driving decision making. So the vision for the data analytics workforce, we've created, you know, data analysts, data scientists, data engineers, and underneath that there are sub-competencies. We really want to launch a national data and analytics digital academy, where I'm being creative and entrepreneur in how we fund that, but that's very much the way that we invest in lots of technology with third parties. Part of their corporate social responsibility should be to contribute towards an academy so that we can actually give back to the workforce. We'll also be using our apprentices levy. I don't know if any of you actually use your apprenticeship levy for training, but that's money that's available to every one of you and every organisation that we should actually be combining to use more effectively. Through that, we will work with the Leadership Academy, make sure that we have apprenticeship schemes. I'm really keen, most of the problems in analysis with NHS data is context. You cannot make good decisions if you don't understand the context in which the data was collected, how you actually use that analysis to actually drive decision making. That contextual knowledge is tacit. You can't write it down in a book. So therefore, it's really important that we have almost a vocational piece where you actually learn the environment, you understand, you actually get close to the data, you understand what it means and how to use it, when it's appropriate, when it's not. And that's really, we want to move towards kind of apprenticeship schemes for that. We also want to make sure that we have cross-fertilisation of all the analysts as well. So a lot more movement between the schemes. Some of you will be, analysts that have worked primarily on BI and reporting, but you want to learn how to code. We should be able to give you cross-functional training to support that. We also want to develop a skill set around data science and engineering, which is new, but again, we can train up. The power of the NHS data should be that we can train up a cadre of people to handle that more effectively. So the competency, the reason we're doing the competency, and Andrew, do go and speak to Andrew at the breakouts, we're really trying to do this to professionalise the workforce so that we can make sure that we understand where our skill gaps are, we actually understand what to invest in and how to make sure the training is relevant. So look at the competency model. It's a self-assessment as well initially, so you can take that and then work where you are and then help us understand where the skill gaps are. That we're already working with a number of ICSs to do this. I'm going to talk a bit about system transformation now, because we can be really impatient and say we want to do this most sexy piece of analysis and we want to move to the new ways of working tomorrow. There's kind of 101 foundation steps that we need to have. We do need to have the infrastructure in place. We do need to have people that understand how to curate data. We do need data standards. So some of all the boring reference data, all those things that people don't find that sexy are actually critical. If we want to move fast and we want to move well, we actually need to have that data foundation in. The data foundation, we can have shortcuts through digitalisation. So as we're digitalising the NHS, we should be thinking about meaningful data that we collect as part of the digital workflow, which then actually allow us to create different ways of collecting data. And the technology makes it a bit more easy for us to do automated APIs, etc., in order to collect the data. That's really important because we will now start changing some of the large data sets. So things like SUS, mental health collection, the community health collection, we're already doing some work on. Actually, how do we make this data specification change? How do we link it with reference data so we collect less data in one big chunk, but more frequently, so that we can have more timely data to do your analysis. So that's against the foundation and digital is what we're trying to do. We also want to design our analysis to be much more experimental and agile. So the operating model for data and analytics is very much working in conjunction with the business in order to better understand what are the business solutions that we need to drive. How do we work together to solve problems as a multidisciplinary team so that we can make sure the analysis that we do is not in isolation. It's not, we've done this piece of analysis and you're daft because you don't understand it. It's how do we combine it so that we can help and improve decision making. And then really that, I think a signal, how will we know we've got there, is when data and analytics folks are sat on the senior execs and sat in the room when decisions are being made, when strategies are being set. So that's almost our goal, want to seed you all into those type of roles. And that's when we'll actually start being able to make sure that all the purposes that we create are actually being used in the right way. In thinking about this, we looked at the federated data platform. We've also looked at how do we tackle digital and infrastructure, and very much really thinking through how we use all of that information to orchestrate what happens to a person. So we're moving away from collecting data at service level to actually data about a person. So the curation effort is actually less because we know it's associated, almost events in the person's journey as they go through health and care. The capability roadmap, we've been doing this for a while. We're actually starting we're starting to look at federation, and I'm really pleased that we've been able to actually honour some of this work. For the federated data platform, just as a quick update, we are quite close to the final submissions. They're due next week, actually. 18th of July, they're due, probably a week after. And then we've got 2 weeks of evaluation, 2 weeks of moderation before we down select from 3 suppliers to 1. So very much on time in terms of making sure that we have capacity and capability of a data platform from which we can build out some of these ways of working. I'm going to pass over to Sue now.